With the rapid advancement of robotic surgery, there is a need to develop a robotic surgical education assessment and training tool similar to FLS for laparoscopic surgical training. The objective of this video is to develop and test an all-in-one psychomotor skills prototype for possible use in development of the fundamentals of robotic surgery curriculum. The prototype device in this video was built with simple household materials including an 8-inch styrofoam ball cut in half, felt material, foam shapes, wire, magnets, hair ties, puff paint, shirt buttons, and a latex swimming cap. The 7 skills evaluated by this prototype include docking and instrument insertion, end-to-wrist manipulation, knot tying, suturing skills, utilization and switching of the 4th robotic arm, cutting and dissection, energy use and dissection. Seen here is a simulation setup where the dome prototype is placed inside a robotic docking model. The instruments used in this video include the bipolar Maryland dissector, the monopolar curved scissors, the needle driver, and the progress. The first task is docking and instrument insertion, where the learner is to dock the robot, insert the instruments in a safe manner, and demonstrate all instruments in the field of view. The second task is the ring tower transfer. The learner is to pick up the ring from the middle tower with one arm without touching the wire, transfer the ring to the other arm, and then place the ring on the side tower, and again without touching the S wire. This is done twice. The goal of this task is to evaluate end-to-wrist manipulation, hand-eye coordination, use of camera and clutch, and atraumatic handling of tissue. Task number 3 is knot tying. Here the learner is to perform a surgeon's knot so that the eyelets touch, followed by one throw. Task number 4 is railroad track, where the learner performs horizontal mattress suturing through the target points. Instead of a running stitch, horizontal mattress suturing is to be performed as to evaluate needle handling and suturing in various directions. In this example, an O vicryl is used. As you can see here, a button was used to affix the beginning of the suture. In future models, the suture will be longer in order for the learner to finish the railroad track suturing with knot tying. Task number 5 is utilization and switching of arm 4. The learner is to pick up the simulated vein with one arm and the other arm to provide retraction. Then the learner is to switch from the 4th arm to the monopolar scissors in order to cut the vein at the hash marks. This exercise evaluates use of multiple arms and use of the monopolar scissors. Task number 6 is the Cloverleaf dissection. The learner is to cut the pattern without cutting through the underlying tissue. In the model, colored felt material is used below the latex skin layer. This exercise serves to evaluate cutting and dissecting skills as well as tissue handling. If the learner puts too much traction, the model tissue will tear. This exercise also evaluates manipulation, cutting, and dissection of tissue at various angles. Additionally, the exercise forces the learner to use multiple arms to allow for better exposure and retraction, and the learner must learn to maneuver tissue similar to situations encountered in the operating room. The last task, task number 7, is vessel energy dissection. Here, the learner retracts the cutout flap with the fourth arm, dissects through the underlying tissue to expose the vessel, and uses the bipolar instrument to cauterize and finally cut with the monopolar scissors. This exercise utilizes 2 sources of energy and evaluates dissection, cutting, and use of multiple arms. These next few pictures demonstrate the model after completion of all exercises. The total time for a novice to intermediate learner to complete all exercises was 15 minutes. This all-in-one model is reusable, and only the skin of the dome needs to be removed and replaced with a new skin for the next learner. Also, magnets were used to allow for easy placement and removal of the cones. The total cost for this model was approximately $15. Although some improvements and adjustments are to be applied to future models, this video demonstrates the feasibility of creating an all-in-one economic psychomotor skills model for robotic surgery training.